All right, good morning and good evening, everyone, wherever you are. We will get started here in about 2 minutes. We will start about 1 minute after to give people time to get logged in. So we'll start at about 7:01 Pacific time and 7:31 India time. All right. Hello, everyone. Good morning, good evening, wherever you are. We are going to get this started. I'm Professor Sarah Miller from Pierce College in Washington State, moderating our fifth webinar on disaster management in India and the United States. Today, I'm pleased to welcome Dr. Aparna Samudra and Dr. Ryan Rockabrand, who will talk to us about the economics of disaster in their respective countries. Dr. Samudra will start us this morning. She's an assistant professor in the Department of Economics at RTM Nagpur University. She started there in 2013, but she's been teaching for over 25 years. She has both a PhD and an MBA in economics. She's done research on the gig economy workers in Nagpur and situational analysis of financial inclusion of street vendors in Nagpur city. She's currently guiding 3 PhD students, with 3 more being pursued. She has 36 publications in peer-reviewed journals and 5 chapters in edited books. So she's created a lot of e-content for the Swaram Prabha project of Ministry on Education on environmental economics, macroeconomics, and microeconomics and applications courses. And they are broadcast on the Swama Prabha channels and on their YouTube channels. So with that, I'm pleased to welcome Dr. Samudra with her talk this morning.
Thank you very much, Sarah, and Ryan as well, and all the participants. I'll just share my screen, and we'll then discuss about...
We're not seeing your screen shared yet.
Is that okay?
There it is. Yep, great.
Yeah, okay.
Thank you.
So, as Sarah said, this is a joint webinar where we have been taking a series of presentations on the various aspects of emergency management and disaster management. Today, I'll be talking about the economics of recovery in context of India. Let me just take you through that. What is disaster recovery? Basically, what we understand is that if a disaster has happened, then in order to restore the normalcy back, it might include rebuilding the infrastructure, rebuilding the livelihoods, as well as the social system. So the process of bringing back the normalcy which has got disrupted because of this disaster. So disaster recovery is basically rebuilding back of the area where this disaster has occurred. Of course, disasters are not only a humanitarian crisis, but if we look at it from the point of view of economics, it is an economic shock as well. Because it is not humanitarian, because it is economic shock, it is therefore a development and economic issue. Now, whenever we talk about these recovery policies with respect to economics, we have to decide whether we need the communities to bounce back to the original position from where, when the disaster occurred. Do we have to get them back to the position, or we need to have a build back better position? So do we have to take a step forward, or do we have to be get back to the status quo? When we talk about India, India is a diverse country where we face a number of, we are vulnerable to various kinds of disaster. Maybe it may be hydro disaster, something like a flood, cyclone. Presently, we see in India, we are seeing a lot of cloud bursts happening in the northern part of our country, Himachal Pradesh as well as Jammu and Kashmir. The India is also susceptible to earthquakes and landslides. Of course, we have seen in 2020 the biological disaster in terms of the COVID pandemic, and we also have seen a Bhopal gas tragedy, which was an industrial disaster because of leak of the gas. This map, which I'm showing to you in the presentation, is depicting the vulnerability of India with respect to the various disaster. So if we see go to the northern part of the country faces the risk of landslides, cloudbursts. If we go to the coastal region, there is a problem of cyclones. Particularly, we see Andhra Pradesh and Odisha. We see a lot of cyclones happening. We also have drought-prone zones in the southern western part of the country. Also, of course, the country, because of the Himalayan region, it faces a lot of seismic risk because of earthquakes. Now, if we want to estimate the cost of disasters in India, I have referred to this international disaster database, where there is an estimated loss from last 25 years, starting from 2000 to 2025. It shows that 1.14 billion people in last 25 years have been affected by these disasters, both natural as well as technological disasters. The damage is of around $124 billion. And however, if we see that insured damage was only of $5.33 billion, that is a big gap in India. That is, the insurance coverage is very low compared to the the western part of the world, where insurance has a better coverage. In India, generally the general insurance coverage is very low. Therefore, if you see, the damages were of around 124 billion, whereas only around $5 billion were the insured damages. So this means that this gap has to be either borne by the people who are bearing the the damage due to this disaster, or it is borne by the government at the central level or at the state level. And sometimes, and rather most of the times, India takes the help of some international agency like World Bank to reconstruct back the disaster, the damage done by this disaster. Now, if we go to the economic aspect, as many of us might be knowing, that the impact of the disaster, if we talked about in terms of economics, it is a direct loss. The loss because of damage to homes, loss due to maybe the damage to roads, to agriculture, to the power system. Apart from this direct loss, we also see indirect loss in terms of loss of jobs, loss of education, and health disruptions. Now, both these direct and indirect losses lead to a multiplier effect in terms of reconstruction, which generates growth opportunity. Of course, there is an equity concerns because poor household and informal workers, particularly in India, where we have a lot of unorganized sector, they suffer disproportionately more because of such disasters happening. Now, if we see these stages of economic recovery, when we talk about disaster management, the first thing, of course, is the immediate relief which has to be provided to the people in terms of food, shelter, medical assistance, and cash transfers. For example, today only we seen that we had a tremendous landslide and a cloud burst in Jammu region of our country. And the immediate help is to let people have a shelter, let them have food. So that's the immediate relief. Then we come back to the short-term recovery, which is rebuilding of the basic infrastructure and, of course, the livelihoods. Then is the long-term recovery, which is infrastructure upgrading, where we talk about in the first slide, as we said, building back better, infrastructure upgrading, and of course, employment opportunities and employment guarantee, because many people lose jobs because of this disaster. And then we talk about resilience, resilience in the term of disaster resilience planning and early warning system, so that if something again arises in such a situation, then what needs to be done, how we can reduce the damage which may occur because of this natural calamity. Now, when we talk about disaster financing in India, now India has a federal structure wherein we have central government as well as the state governments. How the funds will be divided is decided by the Finance Commission. Now, it's a body which is set up every 5 years. It decides that how the revenue between the central government and state governments will be shared. Similarly, what will happen to the type of expenditures which is going to be made at both the central government level as well as the state government level. So the picture that you are seeing right now on the screen is talking about that how financing of disaster management is being recommended by the 15th Finance Commission in India. Now, accordingly, what we see is that this disaster, it has divided the risk management fund at the national level as well as the state disaster management level, because we have a federal structure. So the funding of the risk management for disaster is done at both the national level by the central government and at the state level by the respective state governments. So we have National Disaster Risk Management Fund, as well as we have a state disaster risk management fund. When we go to the National Disaster Risk Management Fund, there are two types of funds which are, this fund is divided in two parts. One is the mitigation fund and other is the disaster response fund. So this means 20% of the total fund which is allotted under National Disaster Risk Management Fund, out of this 100%, 20% will be used for the mitigation of any kind of disaster which is, which may occur. And 80% is left for the response, that if disaster occurred, then this fund is used. Similarly, if we have a look at the state disaster risk management, 20% goes out of this 100% in the mitigation fund of the state, and 80% goes in the state disaster response funds. Now, as I have written here, the mitigation fund comprises of both National Disaster Risk Management Fund and State Disaster Risk Management Fund at both the national and the state level. And the response comprises of the sub-allocation further in response and relief, recovery and reconstruction, and preparedness and capacity building. So whatever money this particular response for the mitigation as well as response is further divided in, money is going to be spent in response and relief, in recovery and reconstruction, and again preparedness and capacity building. Now, we have just understood that structure by which the disaster management fund is allotted in India. Now, on what basis the fund is allotted to various states? Because I've just talked about that we have a federal structure. Now, for each state, when the fund is allotted, the Finance Commission sees these three aspects. One is the capacity. That is, the fund will be allotted on the basis of capacity. That is, in the past, how the expenditure has been done by the states in case of response and in case of mitigation. Second, what is the risk exposure of that state? How is it calculated? It is calculated by way of area of that state which is exposed to this risk, as well as the population which is coming under this risk ascertained area. The third methodology which is used to calculate the funds which need to be allotted is hazard and vulnerability. That is, the disaster risk index is used to measure that how much funding will be given. That would be based on hazard and vulnerability also. So these are the three ways which are used to decide that which state will be allotted how much of fund. So one is the capacity of the state, that is how the state has used its past funding. Second is the risk exposure in terms of the area and as well as the population. And third is the disaster risk index, which is calculated by way of hazard and vulnerability. Now, this methodology of risk allocation, as I've said, goes for both at the national level as well as the state level. Now, as I just told you earlier, from the total year marked, 20% is for mitigation and 80% for the response fund. Now, if we see the present 15th Finance Commission, a total corpus of 1,60,153 crores for 5 years, that is from 2021 to 26, has been given to the states. We have 28 states in India, and a corpus of 68,000 crores rupees, Indian national rupees, is given to the national at the national level, and the central government, in case any calamity happens, any disaster happens in any state, then the central government has this fund, and this fund is then allotted to the state at which the disaster has happened. Now, I would like to share a case study with you on the Kashmir floods, which happened in 2014. Now, this case study I've taken from the National Disaster Management Body of India. Now, just to give you a brief, Kashmir, Jammu and Kashmir is the northernmost state of our country. And the topography of this region is mostly mountainous. The Himalayan range goes through this state. Three major rivers flow through the region, which are Jhelum, Chenab, and Indus. They are basically the Indus water which we talk about. The main occupation of the people in this region is horticulture, handicrafts, and tourism. Kashmir is also called as the Switzerland of India. So it sees a lot of tourism. So people are dependent on tourism and as well as the handicrafts and the horticulture. Now, this disaster which I'm talking about, it happened in September 2014, the first week of September 2014, where it saw the state, some districts of the state saw unprecedented rains. Now, these unprecedented rains led to a flood, this flood affected around 2 million people and claimed around 287 million lives. If the cost of this whole flood was calculated to be around $9 billion, and it caused huge damage to the property, assets, economy, ecology, as well as both the social and the physical infrastructure. Around 5.5 lakh population was displaced, and over 6.51 lakh hectares of cropped areas were affected. As I've just told you, that many people are dependent on horticulture for their livelihoods in this particular state, and around 6.5 lakh hectares cropped area was affected because of this rain, which happened, which led to a flood in this region. Now, if we go to the causes as to why this happened, one was, of course, the global change in the global temperature, climate change, which increased the water level. There was a population growth, more people living in the vulnerable areas. Not only that, I will just tell you that how unplanned development also led to this flood. Deforestation, because a lot of forests are there for need of timber and wood, a lot of deforestation happened. Then unplanned construction led to the land use changes. So many construction was done in the riverbed only, which led to flood. Aggravating reasons for this flood, apart from this, were rapid urbanization, which increased surface runoff volume, because there is a lot of tourism. In order to accommodate those tourists, many hotels got developed, and it was all unplanned development. Then water body encroachment, as I told you, many hotels and many, particularly urbanization, happened in those areas which were basically the riverbeds. And of course, disappearing wetlands, which led to diminishing natural water storage. Now, after this disaster happened, the first was, of course, the immediate relief, because for that, a joint rapid need assessment were around 16 teams were deployed in 108 villages. And this team reported that 86% of that area in those 108 villages were affected. And the major damage were to the shelter, water, sanitation facilities, agriculture land, as well as education. As we just saw, that any disaster which happens, it is not only getting limited to the direct losses, but also to the social infrastructure in terms of health access and the education. This is data which was assessed by Joint Rapid Need Assessment Report, which said that there was a direct loss of around 14 lakh household assets were destroyed. Around 68,000 houses was fully damaged. Around 66,000 houses were partly damaged. Total population was estimated to be around a crore, which lost either directly or indirectly. There were around 280 deaths, and houses, around 1 lakh houses were left uninhabitable. Now, also, there was an effect on food security and livelihood. When the assessment was done, it was seen that around 82% of the stocks, food stocks I'm talking about, were severely destroyed. It led to loss of food consumption of around 86% of the people reduced their food consumption because of this. Around 17,000 acres of land was completely destroyed. Markets were running out of stock. 81% of the markets and that area did not have food available. Cost of food increased tremendously. It was around 63% of the food cost increased, and loss of livestock was 43% in Kashmir and 7% in Jammu. Now, if we have a look at the social indicators, particularly if we talk about water and sanitation, WASH as we know them, 53% of the water sources were damaged. Uh, Earlier, before the flood happened, 63% of the population in this area had piped water. After the disaster happened, 13% of the people went back to wells to get water, 29% were using pond water, and 30% were using tube wells. 85% of the sanitation facilities were damaged in this area. So that had a lot of health adversities because of that. Similarly, if we see towards education, thousands of schools were damaged. Hence, thousands of students were displaced. There was a lot of number of students who never returned back to school after this disaster happened. Hospitals were shut down. 20% increase in the death of neonatal deaths were there because they could not access to the nearest hospitals because the roads were damaged because of these floods. Now, post-flood, if we see, post-disaster initiatives were taken at both the state level as well as the central level. However, when we look at the the preparedness of the state government of this flood, it was seen by the National Disaster Management Authority that post-disaster, the erstwhile state government of Jammu and Kashmir, which is now a union territory, it lacked a good assessment of damage. Good assessment of damage was done only in 3 out of 6 tested districts. Randomly, these 6 districts were checked by NDMA, and out of 6, only 3 there was an assessment done, and need assessment was not done in any of the districts. Around 2,700 rupees is to be paid to every person who has lost their houses or their houses are damaged in flood as per the government of India. About 75% of these cases did not receive this payment for a period of 3 to 6 months. So as minimal as 2,700 rupees, which may be coming to around maybe $10 to you, only they were paid after 3 to 6 months. And also, if we see the cost to the central government, around 2 crores were given to the state disaster response force by the to the Srinagar Municipal Corporation for the collection of garbage and its disposal, which was left behind after these floods. Now, when we come to the central government, that is the Union Government of India, central government provided a special plan assistance of 41,000 crores. International help was also sought out by the World Bank, which under Jhelum Tavi flood recovery project, 1,500 crores were given. Then, if we come to the role of insurance sector, as I showed you earlier, very few people in India actually take general insurance for the damage to their property or to any kind of assets. But whatever they were, the government at that time, people had to approach the High Court to the no, and asking them that the insurance amount be paid early to them. So it said that 50% of the insured amount for policy of 50 lakhs and 95% of those policies which were below 25 lakhs were to be given immediately. Total claims filed was around 50,000 claims were filed. You can see that lakhs of people lost their houses, but only 50,000 foot filed claims because they were not insured. And the claim was around 1,800 crores was paid. Now, if we see the lessons which need to be learned in such a case was one, there was a lack of flood recognition. The state government never realized or never earmarked those areas which were identified as prone to flood. There was an inadequate coordination between the state governments and the central government. Hence, the disaster response was late. The district disaster management authority was not set up. Hence, the immediate relief could not be provided. And of course, there was a total disregard for environment and ecology, which lead to the unplanned development. Now, coming back to where we started, that what are the opportunities for building back better? One, it is suggested that the resilient infrastructure in terms of climate adaptive housing need to be done. Social protection, as we saw, that people lost their livelihoods. People, children, they were dropped out of school. We saw people could not access to their health facilities. People lost jobs. So India has a lot of social security in terms of job security through Employment Guarantee Act. So these need to be reinforced more in those areas where these disasters strikes. Similarly, India needs to talk about renewable energy and watershed restoration programs. Then livelihood revamp in terms of training and support needs to be given to the informal workers. And of course, use of technology. Even though India is going ahead in terms of, predicting the disasters, but still at the ground level, somewhere we get left behind. Hence, this data and technology, AI particularly, needs to be used in a better way. So that's all from my side, explaining you that how disaster management in terms of economics is done in India, and a small case study on the Jammu and Kashmir floods. So thank you very much. I hope my presentation is closed, Sarah.
It is. Thank you so much, Dr. Samudra. That was a great presentation. We very much appreciate it. Now I will introduce Dr. Ryan Rockabrand. He is the emergency manager for King Abdullah University of Science and Technology in Saudi Arabia. He previously worked for both the National Nuclear Security Administration and FEMA in emergency management roles. While at FEMA, he was a federal disaster recovery coordinator responsible for recovery management of disasters across the United States. He's an adjunct faculty member here at Pierce College, where he teaches disaster recovery and artificial intelligence for emergency management courses. Ryan received his PhD in artificial intelligence from Capital Technology University, where he researched the role of artificial intelligence in emergency preparedness for small modular reactors. Prior to his federal service, he spent 7 years in local emergency management and 10 years in the private sector. And with that, I turn the floor over to Dr. Rockabrand.
Hey, thank you, Dr. Miller. Hopefully you can see me okay and hear me okay, comm check. And I will just say hello to everybody and then turn my camera off just so I can save bandwidth here, but hopefully everything else is coming through. All right, so again, thank you very much. Dr. Samudra, thank you so much for your presentation. That was really striking to me, the similarities in terms of the economy, the economics of disasters between our two countries. And I think what was even more striking was the similarities in our presentations. So for the audience, you'll see a similar theme throughout. So as Dr. Miller mentioned, my name is Ryan Rockabrand. I am currently the emergency manager out in Saudi Arabia for King Abdullah University of Science and Technology, and just really privileged and honored to be here with you today to share a little bit about how disaster recovery and economics works in the United States. Next slide. So very similar to what Dr. Samudra just presented, in the United States we have a similar multi-layered ecosystem of how funding works. At the federal level is the safety net, if you will, and then state and locals handle the initial response, but once those resources are exhausted, the local jurisdictions will submit a request for federal support. But that kind of first wave, if you will, of support would not be successful if it weren't for the engagement and the engine of the private sector, and then the resilience within the community itself. So we'll talk a little bit about mitigation as it relates to that ecosystem. But what's really important, I think, to capture is over the past 45 years, we've had over $400 billion disasters in the United States with cumulative losses of almost $3 trillion. And as Dr. Samudra mentioned, they're only becoming much more profound and prolific and more frequent in the United States as well. And so the ecosystem is not successful without the shared responsibility and how this current framework works. Now, if anybody's paying attention to what's happening in the United States, we are going through a pretty profound shift in emergency management writ large. And so I want to talk a little bit about the way it has been to date and what we're potentially looking at moving forward. Next slide. So currently, the way disasters are functioning in the United States, as I mentioned, once the state and local jurisdictions have exhausted their resources, they submit a disaster declaration request to the federal government through the state. And those assessments are based on the capabilities at the local level, but that works through what's called our policy of the Stafford Act. That's what authorizes FEMA to spend taxpayer dollars to support local disasters. That program has some key requirements for states and locals when they apply for a disaster declaration, namely at the bottom, the big ticket items is that they have to maintain some comprehensive documentation, particularly a preparedness plan that has to be reviewed and approved before declaration requests to meet those obligations. I'll talk a little bit in a slide here or two about the cost share. I believe Dr. Samudra said it was about an 80-20 split in India. By default, it's a 75-25 split in the United States to start. But I'll explain a little bit about how that does shift depending on the nature of the disaster. And the state and local jurisdictions must be compliant with procurement, environmental, and what we call EHP, environmental historic protection or preservation requirements. And so all along the way, they have to maintain proper documentation and the reporting requirements regarding the funding allocations, both before and after a disaster declaration. So I mentioned earlier that we're going through somewhat of a profound shift. The current administration is looking to state and locals to absorb a lot more of the overhead and the costs as it relates to disaster declarations. So before we were seeing a pretty streamlined process where once the threshold was met, a state would submit a request to the federal government, and then based on achieving that threshold, a disaster declaration would be allocated. Today, there's a lot more scrutiny as to whether or not those requests will be approved, and there's a lot of question moving forward as to whether or not those funding streams will be available, if at all, to state and local jurisdictions. So a very significant paradigm shift we are undergoing in the United States today, but what we're going to talk through here is kind of the way it has been and the way it works through today. Next slide. So with that said, I wanted to give a couple of examples about how this profound shift is happening. So if you see here in FY25, the amount of funding that's available, so every year Congress will allocate an appropriation to FEMA through the Department of Homeland Security, which allows funding to support these declarations once these requests come in. And that's what's called the DRF, the Disaster Relief Fund. And to kind of put this in context for you, you can see the DRF for this fiscal year is almost $58 billion. Last year was $35 billion. But I can tell you, going back to my days at FEMA early on, the average annual was only about, I shouldn't say only, but was about $7.5 billion a year. And that was significant at the time. And so what would happen is, depending on the number of disasters that would come in, unless there was an emergency appropriation, we would always find ourselves in a situation where that $7.5 million was spent pretty quickly as more disasters were occurring. And so in the United States, you have to go back to Congress to ask for an additional appropriation for more funds. And it puts FEMA in a really precarious situation, because if there are disasters coming in, but there isn't enough money, then what happens is FEMA has to move into a posture of what's called INF procedures, immediate needs funding. And what that means is that FEMA has to prioritize life-saving and property preservation funding first. Anything that's ancillary to that, things that are focused on the long term of recovery, would not get any type of immediate or expeditious funding. And so that made communities and state and local jurisdictions much more vulnerable, because they wouldn't have that source of funding available to them up front. Since 2000, I want to say that has happened 8 different times. Where FEMA essentially ran out of money and had to go back to Congress. The last time was when I was in Hurricane Harvey in Texas during 2017, where we ran out of money pretty quick. And then if you recall, that was a pretty bad year where we had Hurricane Irma, and then in Puerto Rico with Hurricane Maria right on the heels of Harvey. So that led to a significant supplemental funding thereafter. But depending on which year, on average, it typically comes into this 80-20 split, where most of the money goes towards what we call public assistance programs. This covers debris removal, any emergency protective measures that are taken at the state and local level that are reimbursed, and then a big chunk of money goes towards infrastructure reconstruction. And then the 20%, 18% listed here on the slide is what goes to the individuals. This covers things like temporary housing and other expenses related to home repair and replacement. And then I think the big kind of thing that is an eye-opener for folks at the state and local level that are going through a disaster is the understanding that this money, when it comes in post-disaster, from the individual's perspective, is that funding is there to make people habitable, not to make them whole. And what we mean by that is Dr. Samudra talked about Build Back Better, and I'll get into some details about that in a minute. But essentially, for homeowners and for individuals, this concept of it's not going to be exactly the way it was before. We're going to get you to a point where you can get just enough to get back up on your feet and maybe get back into your home or give you some temporary housing, but it's certainly not going to be where you feel a level of acceptance in terms of comfort of living and standards. So that's very difficult for people to digest in terms of the federal money that's coming to help support them. And then there's also some mitigation money that comes as a carve-out, which I'll talk about here in a second, how that works post-disaster versus pre-disaster. Next slide. Okay, so I mentioned this 75-25. The reality here is that that's sort of the jumping off point. The larger the disaster, the more attention it gets in the media, the more significant the impact from an economic perspective, especially in terms of GDP impact and the types of public and private sector infrastructure that's been impacted. If there are significant financial concerns at the state and local level, they can submit a request to go to a 90-10 split, meaning that for those severe events, the federal government will cover 90% of that overhead. And there have been times where we have gone to 100%. Most notably, those require some very novel situations, but most notably was when the Biden administration took over in 21. They did a 100% reimbursement structure and retroactively put it to before COVID. So why that's important is because a lot of state and local jurisdictions then had to go back to look at expenditures and the way that their accounting codes were working in order to be reimbursed for that additional 10%, and in some cases 25%. And then again, I mentioned that this is the FEMA money that's coming in. I'd be remiss if I didn't talk about the rest of the federal landscape, albeit slower to help support those that are in need. But there are a significant number of other federal agencies that have disaster funding available to them, whether it's through discretionary funds or existing appropriations. Most notably is HUD, or Housing and Urban Development federal department. They have what's called our Community Development Block Grants. These are HUD monies that come in, but you can see the designee there for DR. That means disaster relief. So they can do some carve outs, but again, this is for long-term housing solutions and housing development. The EDA, which is part of the Department of Commerce, also has grant programs available. And then in the recovery world, the long tail, there's about 102 other federal agencies or divisions within it that have funding that state and locals can tap into through other grant programs. So it takes a lot of due diligence on the part of state and locals to submit all those applications, to track those monies, to make sure that they're compliant, which is a very significant burden when you're going through a disaster. Next slide. And this is really where that gap comes in. So Dr. Samudra was spot on when she talked about that delta between the cost of the disaster versus what's available. And this is where some creative financing, if you will, comes in from the private sector for local investment with some other mechanisms when it comes to insurance opportunities. So this space is unfortunate when it comes to flood. The NFIP, the National Flood Insurance Program, is always at a woeful loss annually. A lot of people don't carry that insurance. It's a burden for them financially, and just don't have that mechanism in place. The statistics do show that you are 85% less likely to report if you do have that, because you're able to sustain a much more expeditious way to get to recovery. But again, it's just an overhead. Dr. Samudra also talked about this, the humanitarian aid that comes in to help support, to make up that delta, and all these other factors that the private sector can play a significant role in. But insurance is one of those areas where we need to pivot to new models, new opportunities. And so I'll talk a little bit about some of those ideas here in a second, specifically with what we call cat bonds and parametric policies that are creative ways, maybe risky investments depending on who is looking at it, but are additional vehicles, especially with the lack of potential federal funds in the United States, that local jurisdictions are starting to complement now. At the bottom here, you can see these challenges. They do take some significant champions at the local level to adopt a lot of that, specifically municipalities that want to take on a bond. There may be some upfront costs there. But the nice thing about some of these parametric policies is that they immediately pay out. There's not a lot of requirements when it comes to damage assessments and submitting reports in order to be deemed eligible for support. What happens is, in a parametric situation, if you're a part of that area of impact, the area writ large is designated as a payee, so you immediately get funds dispersed and available to you based on what those cost outlays are in the policy. So that expeditious nature of it is very attractive because it helps people get back on their feet quicker, hopefully not have to leave the area and relocate and deal with that additional burden, which helps people get back to work quicker and then get their kids back in school and open up daycares and help that economy get back on its feet a lot quicker. So there's pluses and minuses to that, but as you can see, probably the biggest thing here at the bottom is that the cash loss, the loss of cash flow at the local level is immediate, and if you are relying on federal reimbursement, 6 to 18 months here is probably being generous. That's probably the average over time, and it's very, very difficult once you get past that immediate 36-day window where people can survive on their own accord. Next slide. So getting down into timeline, again, very similar to what Dr. Samudra kind of spoke to here as well. For me, the key takeaway here is that people appreciate the long-term recovery piece of this. So everyone is focused within the first 72 hours on the response side. We say early recovery is from days to months and long-term is months to years. The reality is once you get into that 90%, 100% time frame, you're into the multi-billion-dollar disaster declaration process. It's really years to decades. To give you a couple examples, the Northridge earthquake in California, that took in 1984, that took almost 25 years to close out that disaster. Yesterday was the 20th anniversary of Katrina in the United States. And I can tell you that Joint Field Office, Disaster Recovery Office is still open down there in Baton Rouge and will not be closing anytime soon. They're still closing out those declarations. So there is a real long tail to some of these disasters that are significant when it comes to the long-term commitment. And from the emergency management side, you have to think about who's managing those long-term recovery efforts. Because, as I mentioned earlier, the compliance, the documentation requirements, the funding allocations and tracking, it's very rare that you have somebody working that from the front to back. And so you have to make sure you've got proper transitions to new staff coming in, whether it's through attrition or retirements or new folks coming into new milestones within the recovery. So you'll bring in new expertise to handle those investments, but it's always a transition of staff over time, and you need to make sure you've got a strategy to do that proper handoff over the months, years, and decades. And then the wrapper piece of this is mitigation and resilience money. Sometimes this is in addition to or augmenting the disaster declaration money, and so as you're focusing on those efforts, they need to be part and parcel to those milestones I mentioned earlier. So building codes change, urban planning initiatives change. You might do things like Dr. Samudra talked about, deforestation. So anything in the surrounding area that may have an ancillary impact on your recovery efforts all needs to be taken into consideration. And it just takes a lot of effort in terms of the communication and education with those communities. And the makeup of the communities, quite frankly, changes too, right? People are moving into the area, people leave the area, there's a transition in generation. So the long tail of this is really significant. Okay, Sarah, I'm looking at the clock here, a couple more slides. I wanted to talk a little bit about just how recent and prolific this is growing here. You see I mentioned the almost $3 trillion. But just in 27 of these in 2024. Sorry, Sarah, I'm not seeing that slide transition. Maybe it's on my end. There we go. Okay, thank you. Just in 2024 alone, we had $27 billion disaster events, almost $180 billion worth of economic impact. And that's just the immediate impact, right? You're not looking at, adjusted for inflation over those years, how that works for the systemic and long-term issues, how that impacts those communities. So those are always the funding challenges. I mentioned the incentives to keep people engaged over time and stay in the area, particularly the private sector, because they need to see a return on their investment. And that's really difficult sometimes when they're not seeing local GDP recover or communities be able to thrive post-disaster. So they might move out or on to other ventures. And so that ultimately leads to this imbalance where you're trying to make sure that pre-disaster and post-disaster environment looks like what your planning initiatives look like at the local level. Next slide. So I talked about some trends that are new, becoming much more attractive. These parametric policies, these insurance schemes that are available, I mean schemes in a good way. But you'll see a lot of things like resilience bonds, which is local investments in these types of projects are as a financial instrument for communities. Cat bonds is a way to kind of diversify and spread your policies across multiple reinsurers. And so if there aren't disasters, there's significant payout, but if there is, then it's a kind of a wash. So again, the risk increases, but the potential opportunity there is there as well. Public-private partnerships are something that we're always pushing for. That creates all parties to be empowered and to be part of that recovery effort. And so there's incentives on both sides of the house, if you will. And I can't emphasize enough about this policy evolution. So Dr. Samudra talked about Build Back Better. We did make some strides after 2017 to change the policy. The way it used to be at FEMA was, you build it back to the way it was before, and that was it. But especially after Puerto Rico, we realized that it wasn't built to a standard in the first place, so you don't want to build it back to a subpar solution. So we were able to get some changes in legislation to be able to truly build back better and use funds to get communities to a higher standard that's acceptable. And I think one more slide, I did see a hand up, but we'll come right to that. I'm looking at the clock. I'll close it out here. So just some recommendations here for consideration to look at this, the economics of disasters from a financial framework perspective. You got to spend a lot of time up front. This is probably the hardest part, is to make it really attractive for folks to want to look at the long range, multi-year strategy. The coordination with not only the disparate, numbers of federal funding mechanisms that are out there, but just being able to track and understand the agreements that you're signing up for, and how you're handling the accountability of that. And then these new instruments that are available from a resilience perspective, to focus on opportunities for new investment, being innovative with those approaches to build some new solutions there. And the building codes thing is a real challenge because they're changing all the time, right? Sometimes they're being more enhanced, sometimes they're being relaxed, and that helps change, or can help or hurt your strategy in terms of how you're implementing so a lot of different solutions. But this bumper sticker, if you will, is a real number. Every dollar invested in mitigation, will yield $4 to $7 on the back end of avoided damages. And so those are very helpful to consider when you're explaining, what these strategies are. And again, just looking at the clock, Sarah, I put in some critical, discussion topics for consideration, but I appreciate the time and the opportunity here to meet with you and share a little bit about how the economics of disasters works in the United States. Thank you.
All right. Thank you to Dr. Samudra and Dr. Rockabrand. Are there any questions for either of our presenters today? You can put them in the chat or you can raise your hand and I'll call on you. I have a question for Dr. Samudra. And that is, in India, is disaster assistance from the state and federal government, is it automatic, or do local areas have to apply for that?
Yeah, in case of India, the state governments are allotted as I told you, under that state disaster management fund. But after, if their funds get over, then they have to apply at the national level for that fund.
Okay. It's
So
very
it is like,
similar to the United
yeah,
States.
similar. Yeah, very similar to that. So that creates a lot of problem. And another issue which comes in India here is that the how this fund is going to be used is decided by the central government. So the states have a very limited flexibility on how they are going to provide relief. The guidelines are very strict of the central government. Similarly, another issue in India is particularly if we take into case the climate change which is happening, and in India the type of the erratic rainfall and extreme weather events which we are witnessing from last 4 to 5 years, is that many of the calamities like heat waves, they are not covered under disasters which are eligible to be taken care of. So we see a lot of case of very high heat and people dying, particularly in cities like Delhi. Pollution is another aspect. So deaths because of lightning, they are all they're not considered eligible for any kind of ex gratia assistance. So and also many states are not still financially not so strong that they can contribute that portion of in the SDRF which is required by the central government, because any state disaster response fund, 25% has to be contributed by the state and 75% is by the central government. So when the states were not very financially strong, they are unable to make that 25% contribution. So for them, it's a great challenge.
Thank you for that.
Yeah.
Does anyone else have any questions that they would like to ask? I don't see any. So I will thank you both again for putting together this presentation. I know it's a strange time of day for everyone, but thank you so much for doing that. Our next presentation will be the end of September on the role of disasters in popular culture. And I will conclude this meeting. You will all be able to watch the presentation, the recording afterwards, and you'll be able to share it with others as well. So again, thank you both so much for your time. And thank you everyone who was able to attend today. And hopefully we'll see you all in September.
Yeah. Thank you, Sarah. Thank you, Ryan. Thank you. Bye-bye. Take care.
Thank you.
Bye.